today with me, and he will introduce himself, and we'll see what does he do and what's the relation with this nice white thing sitting here, and then he will explain us about it. But yes, please.
Absolutely. So, hi everyone, my name is Shaheer Piracha. I'm a biomedical engineer by profession, and I'm one of the founders of a medical device company called Umbulizer. I grew up in the city of Lahore, and I was born with childhood asthma. That's part of what's influenced me on the career I've chosen, which is I pursued a degree in biomedical engineering, and then I have I'm right now currently serving as one of the founders of a medical device company called Umbulizer that focuses on helping patients with respiratory disease.
That's nice. Alright, so you are connected to the respiratory zones, I would say, right? You are more interested in that area. So are you out of the asthma now, or?
No. So my childhood asthma started when I was 1, and probably the 1 to 5 was probably one of the most difficult times for both me and my parents. I literally was hospitalized a number of times and danced between life and death practically. And really it was a struggle, and every time when I was at the hospital, even growing up, especially, I was able to cope up with some of my asthma through sports like swimming. But every time the smog season would hit, I would be hospitalized again, and there I would see many patients like me, on nebulizers, and more, heart-wrenchingly on ventilators, or on even those patients who are waiting for ventilators to open. So in a lot of places across public sector hospitals, you will see that there is a need to improve the amount of resources that are there, and because their resources limited, you often find, even if you walk today at a public sector hospital, that many patients are waiting for the ventilators to open up, and while that's happening, you have family members taking turns manually bagging their loved ones. And that is a sight that has stayed with me, and that is sort of a challenge that I want to help address with Umbulizer.
So this is called?
So this is basically, essentially, this is a low-cost breathing device. As a asthma patient myself, I realize the importance of this device and the impact it can have on patients like me and many others. Respiratory disease is the 3rd leading cause of death in Pakistan. And as the smog seasons hit, especially in December all the way to February, and especially in the summer months after the cutting of the crops.
Especially in Lahore, I think.
Especially in Lahore, and it's smog is air pollution, unfortunately, is on the increase over the next couple of years, leading to higher respiratory diseases. And given that, there's a desperate need for patients to get access to these devices. And the goal with Umbulizer is that we've taken a full-fledged $40,000 traditional ventilator and boiled it down, taken out the bells and whistles, boiled it down to what is a portable and effective, easy to use device that can address 90% of ventilation demand and a fraction of the cost.
So this is to be kept at home? You can keep it at home, or is it for the hospital?
It's a great question. I think so. This device can be used in a number of different arenas, from the ICUs to the ERs, emergency rooms, to the wards, to the high dependency units, towards transport as well, given its portability. And home as well is also an evolving use case, and we hope to sort of provide it as a service as well. We haven't been catering to home just yet, but it's definitely on our program.
Oh, okay. So this is for hospitals and other places.
And ambulances for sure.
Ambulances, not in the house.
Just yet. We can potentially,
Can we keep it? Okay. Are you making it smaller, or is it? This is the only size?
Just to give you some context, a traditional ventilator, as you can imagine, is the size of a fridge.
Okay.
So we've taken that and we've really condensed it down to something that you can carry in your arms, and that EMTs can carry, and in multiple cases.
I'll just show you. It was in his small carry-on, so we took it out and show it later when he puts it back. Maybe I'll catch him putting it back. So you are one of the founders, as you said earlier. So how did you come to this? Like, other than that you had the issue, and how did you were able to, this is approved also,
So
and all those
it's a
things.
great question. So we sat down together with, at Harvard, we sat down together with the critical care doctors, some of whom have written the books on critical care medicine. And we sat down with physicians from Africa, from different parts of, from Pakistan as well, from a lot of different countries globally. And we really sat down with them to understand what are the constraints in low resource settings, and what are the different functions that are important to be used for providers so that they can provide life-saving care. Our vision is to help reduce preventable deaths. Our goal right now is out of the 100, can we try to save the 90%?
Or maybe 100%, right?
Or maybe 100% would be ideal. But for that you
The
need all
target
the vessels, all the bells and whistles, and you need to be able to provide that functionality. Right now in Pakistan, the problem is such that even patients who can, like you and me, walk out of the hospital the next day are not able to do that because there's no ventilator available to keep them alive for long enough for the doctor to come and diagnose them. And that's the challenge we want to address.
So this is the time being before the doctor comes, or the doctor can prescribe this to have it, or like, how does this work? And before that, we are sitting in Harvard, and you have to tell, how did you come for the studies at Harvard, and how did you end up in Harvard?
Great question.
You just didn't drop off from the yes.
So I actually did my bachelor's from Boston University in biomedical engineering, and did a program at Harvard Medical School. And primarily, Umbulizer has been part of the Harvard iLab, which is my affiliation to Harvard. It's been part of the Harvard iLab for about several years now, and we've been fortunate to be part of this ecosystem. And we have a very rock star team of engineers who are from Boston, from Harvard, from MIT, and they've been working tirelessly to help bring this device to market. And today I'm proud to say that we've been able to take this product from just an idea to the field where it's being deployed every day in ICUs, in emergency rooms, in ambulances, and it's saving lives.
That's very good. Thank you so much for telling us about it. And it has all these places where I think they put stuff, and so anybody can operate this, or is it has to be a professional?
So great question. So we've made this device and simplified it down, and so that it has, the software can sort of walk you through. So there are 3 different versions. There's a mode in this device that is meant for almost anyone who is in a state of an emergency and needs to help stabilize a patient. They can go on one of the modes and they can help at least stabilize a patient.
Okay.
And then once the patient is stabilized, until a sort of a provider comes, a doctor comes who's specialized and knows how to triage and treat the patient, they can go in and they can go into the advanced settings and sort of tweak and sort of change the settings according to the parameters that they sort of observe and based on their prognosis. So it's basically, this device has been tailored so that whether you are in Safdar, or whether you are in DG Khan, or whether you are at one of the highest public hospitals in Lahore, you can use this device in all of those settings. And primarily, I mean, as a first responder, if you are sort of if the patient has collapsed and you need to be able to transport the patient, you can actually, the bottom line is you can actually get the patient alive to that hospital. So we've taken this product in Boston, working with a team of doctors and engineers, and we've taken it from a sort of an idea to prototype to clinical trials to FDA to now in the field. And one thing I would like to highlight in terms of PHEV and the support we've gotten is that in the early days of COVID, when there was a lot of crisis, a lot of doctors, a lot of individuals actually reached out to see how they can help support the community back in Pakistan. And what at Umbulizer, what we did is we built a partnership where we had a 60-40 matching grant, where we worked with members of PAJB who helped fundraise and collect donations from different donors who wanted to play their role and contribute back to Pakistan. And we played our role by providing us with by matching those numbers, and as well as providing those devices and making a streamlined system where we have devices from our factory reach Pakistan, and in a record time of about 1.5 weeks, right when COVID was on the rise.
So this was created before the COVID?
Yes.
Not for the COVID?
This was not made for this device.
Okay.
Medical devices typically have a 10-year plus life cycle.
Okay.
We've been at Umbulizer for more than 6 years now,
Okay.
and it's taken a while to build it. So this device was built to help address the problem at the baseline for respiratory care that is still existing, whether there is COVID or not COVID. COVID has just magnified that problem.
Right.
And so when this happened, we were able to work and partner with them. One initiative I want to highlight is that when we took Umbulizer from an idea to prototype to clinical trials, and after getting FDA, we sort of launched it at the time when COVID was on the rise. And at that time, donors and individuals reached out to us to see how they can play their role in helping those in Pakistan and providing them with respiratory care support in any way they can. And so Umbulizer sat down with them, and specifically with PAJB, to raise funds, and we built a 60-40 matching grant where we would match those donations that donors would raise, and we would provide the device in record time, and we fulfilled on that promise. We shipped around 35 plus units from Boston all the way to Lahore and different parts of the Punjab.
So did you use this here also in Boston
So
area?
we have a partnership with the state of Massachusetts, and we got encouraged by a lot of the hospitals here for being a very simple to use device that a lot of people in research constrained settings can just use. And that I think is a value proposition. Is like when you have sort of, whether it's a pandemic situation or whether there's just large amount of patients and limited resources.
Right.
You need to have a device that works reliably, and you need to have something that can help reduce preventable deaths. And that's exactly what Umbulizer does.
So is it manufactured in America or in Pakistan?
So this is manufactured right outside of Boston. But we built a very smooth supply chain in place. And the shipment that I mentioned to you, we were able to ship those devices within 2 weeks from when we raised the funds. And to be honest, the funds hadn't touched our and part of the challenge was that we just didn't want to just ship devices. I personally went myself, and during those months, there was highest levels of smog, and
in Pakistan,
and COVID was also on the rise. And so literally, I was on steroids and nebulizing because I was at the same time fighting my battle with asthma while I was there in Pakistan. But I made sure that each one of those devices from donors reached the ambulances or reached the hospital that they were destined to go to. And we also received recognition from the health minister at the time in Punjab for the effort that we've done.
So this is to sustain, it doesn't cure anything, right? This is not a curing device. This is to help you breathe through the stress when you are distressed and when your lungs are in distress, right?
So let me take a step back. So I need to explain. So anytime a patient is in respiratory distress, has struggled breathing, and his lungs cannot breathe on its own, that is where Umbulizer can come in handy. And this can be in a myriad of different situations, whether he has COPD or asthma or severe ARDS. All of those patients, anytime, the first thing the doctor wants to do, anytime, for example, even if he's going into surgery and he's in the first thing the doctor wants to do is control your oxygen and air in your body. And this device helps you do that. And in a majority of cases, many patients who need basic surgery and who can sort of walk out of the hospital 2 days from now are unable to do that in places like in a lot of places in Pakistan because they don't have the infrastructure or the tools needed. Umbulizer is trying to help fulfill that gap by providing a low-cost solution that can help a lot of critical patients get out of the hospital and be back on their feet.
That's very nice. Thank you so much. That's very good. So this is majorly helping our Pakistanis in Pakistan. That's what it is, right?
It is.
Right. So from that point, so this is his contribution, being one of the founders, still going on and marketing this to places that really can use this device. So mainly abhi
Pakistan is one of the countries, and I personally want to make sure that this device reaches every hospital, every ambulance that's in need in Pakistan. And I'll give you an example. I mean, we've just scratched the surface, but we started hearing stories every other day. We hear stories of patients who have been helped by this device. Just yesterday, just to give an example, somebody from DG Khan needed to be transported to Lahore, and because we had an Umbulizer installed locally there, they were able to safely stabilize the patient and bring him all the way from DG Khan to Lahore, where he got treated, and now he's off the hook.
That's right.
So that's the amount of impact each sort of milestone that.
So this is a lifesaver, basically.
That's the hope. That's what we want to do.
That's what it is. Very much. Thank you so much.
What I would like to say is that this started off of a personal need, and in just a few years, with a lot of determination and great perseverance, we're able to reach this place. But that is just to be as an example to many others that this is something anybody else can do out there. All Pakistanis who are hearing this, I like to encourage them that just keep dreaming big. I mean, I hope that Umbulizer serves as an inspiration to 50 more medical devices to come, or 50 more healthcare products to come. We haven't seen a lot of innovation here in Pakistan, and my hope is, and my dream is, that innovators from Pakistan come and help uplift the country, uplift the healthcare of Pakistan. And maybe there will be a day when Pakistan becomes the hub of healthcare and it is exporting to countries across the world.
Can be if you dream, right? and dream comes with action, and this is his action. You have been on it, and you have been working with the team and with people that you have mentioned. We are not going to take names of everybody because that's not the scope of this conversation. But I think if you want to know more about this, where can people go?
So absolutely. So if you want to learn more about Umbulizer, you can email us first of all at contact@umbulizer.com. You can visit our website, which is www.umbulizer.com, or you can follow us on Instagram, and we're happy to chat. And our goal really is to help serve the patients at the base of the pyramid. So if you are, or if you know of someone where we can help contribute and make a difference, please reach out. We would love to create an impact.
So you will deal with the organizations only, or this is you cannot, individual cannot connect?
Individual can also. So we have many individual. We have organizations. We have individual contributors, and we have government level organizations as well. So our goal is really we've opened it up.
Okay.
And we take care of everything from getting the device made to getting the device delivered.
Okay.
And then after delivery, we have a team in Pakistan of doctors from Al Khan who are very specialized, trained, who will come in and make sure that you are able to operate this device successfully and make sure you have a very great experience with using the device. And they've done a fantastic job, and really the lives that have been saved so far are a credit to the people, our team in Pakistan, who have stepped up and become an inspiration for many others.
तो जी अब हम थोड़ी सी उर्दू में भी कहते हैं कि ये ज़िंदगी बचाने की मशीन है। शहीर थोड़ा सा बताएं उर्दू में, ताकि जो हमारे उर्दू बोलने वाले हैं समझे। गांव में लोग देखते हैं, गांव में बड़ी ज़रूरत होती है, वहाँ पे लोग सांसों की प्रॉब्लम की वजह से शायद सफ़र करते हैं। I'm sure आपके पास उसकी भी कहानियाँ होंगी, स्टोरीज होंगी।
जितने भी मरीज़ जिनको सांस की तकलीफ होती है, उनके लिए मशीन बनी हुई है। वो ये गांव देहातों में अगर आप डॉक्टर ना भी हैं, अगर आप बेसिक EMT भी हैं और आपने एम्बुलेंस में किसी मरीज़ को अस्पताल पहुंचाना है, उसके लिए मशीन एक बटन से चल जाएगी और एक बटन में आपको मरीज़ सही सलामत वो अस्पताल स्टेबल हो जाएगा और उसे अस्पताल पहुंचा देगा।
उसकी हालत जो है वो संभल जाएगी, ठीक है ना। और उसके बाद फिर वो ये मतलब EMT जो इमरजेंसी वाले लोग होते हैं एम्बुलेंस में होते हैं, और ये एक वन ऑफ द फाउंडर्स हैं, यानी कि इन्होंने इसमें इनके साथ और भी साथी हैं जिन्होंने इसको बनाया है, और ये पाकिस्तान में मतलब दस्तयाब हो सकती है,
पाकिस्तान में ये मिल सकती है। और हमारा ये गोल है हमारा कि हर गांव में, हर देहात के अस्पताल में, हर DHQ लेवल में ये फैसिलिटी पहुंच जाए, ताकि जितने भी लोग हैं जिनकी जानें बचा सकते हैं हम, उनकी बचाई जा सके।
बहुत अच्छी बात है। और पाकिस्तान के हवाले से क्या आप कहना चाहेंगे कि कोई मैसेज है इस, आप भी एक जवान पाकिस्तानी हैं और आप इतना अच्छा काम कर रहे हैं, तो आप उर्दू में क्या पैगाम देना चाहेंगे अपने जवान यूथ को, जवानों को, यूथ को कि भाई क्या करें? आपके ख्याल में क्या कर सकते हैं?
मेरा ख्याल है कोई भी, मैं जहाँ तक पहुँचता हूँ, एक तो माँ बाप की दुआएं हैं वो सबसे पहले, और फिर कोशिश से इंसान कहीं से कहीं पहुँच जाता है। और मैं जितने भी लोग हैं, आप चाहे यूनिवर्सिटी में पढ़ रहे हैं, चाहे कहीं पे नौकरी कर रहे हैं या अपना कारोबार है, अगर आप एक ख्वाब देख के उसके पीछे चले जाएंगे और कंटिन्यूसली एफर्ट लगाएंगे तो आप कहीं भी पहुँच सकते हैं।
बहुत अच्छी बात है। तो जी आप तो शाहीर इंस्पिरेशन है, शाहीर से भी सीख सकते हैं। हमारे सामने एक एक्टिव काम करती हुई डिवाइस पड़ी है, सो दैट इज़ टू क्रेडिट। व्हाट लाइट्स यू अप?
Like in terms of, I guess,
make you happy, what brightens you?
I mean, like it relates a lot to why I work on this, is like being able to see this. I'll just give you an example. I mean, the work that we do at Umbulizer, the reason why I work on is to see the smile on people's faces once we've helped them. I mean, there's so many stories out there, I cannot stop beginning, but literally they've been fathers, they've been mothers, they've been sons, they've been daughters, who we've played a small role in helping facilitate their treatment, and just seeing their faces at the end and the gratitude in their eyes and in their smiles, I think that's what keeps me going every day.
That lights him up. That's right. What is the meaning of wealth for you?
For me, wealth is in the number of people you can touch or the impact you can have. That for me is wealth. If you have money, does not mean wealth to me. For me, wealth is impact.
That's nice. And these are not prepared answers. He didn't know that I will ask this, so that's more genuinely coming out of him. What is the value of time?
Value of time. If you spend that time, I think if you've done, if you put your best, irrespective of the outcome, if you spend that 1 hour, whether it is enjoying a hike, whether it is helping a friend with homework, or whether it is getting coffee or chai from the local shop. I think time for me is the amount of, if you've given your best and if you've been there in the moment, for me that is time.
Who is Shaheer?
Shaheer is just an average, is just an average student, I would say, who is trying to make a difference in the world.
Any message of hope?
Yeah, I think this is, for me, I think I'm learning every day. There are a lot of problems in the world. We can't solve all of them, but if we try, maybe we can solve one of them.
So never give up.
Always keep fighting.
Anything else you want to say to Pakistanis, youth, Pakistani Americans? Any message?
Yeah, I think given the 75th anniversary of Pakistan, I think this is more than ever, there's a need for that community, diaspora as well as people in Pakistan, to come together and help sustain this bridge of innovation, of commitment, of contribution, so that we can uplift Pakistan, especially in the days to come. As the 75th anniversary of Pakistan, I think more than ever it's time for the diaspora, for those in Pakistan to connect and contribute to create this bridge of innovation, especially in the days to come.
Okay, very nice.
मेरा ख्याल है कि हमें आज के दौर में और एक कोशिश करनी चाहिए कि हम जो लोग बाहर हैं, जो लोग पाकिस्तान में हैं, आज की दुनिया के अंदर हमें उन सब के साथ कनेक्टेड रहना चाहिए और हमें फोकस करना चाहिए कि हम किस तरह सिर्फ अपने लिए नहीं बल्कि अपने मुल्क के लिए खिदमत कर सकें।
बहुत शुक्रिया, थैंक यू।